So I hope those of you who were here for the first session this morning will be as excited as I am about the potential of the two opportunities that were discussed. Really exciting stuff. But now we're going to switch gears, and I'm going to introduce Dr. Joanne Mackey. She got her DVM from Louisiana State, and she has a master's in experimental and comparative medicine from University of Tennessee, and she's the technical director for the North America Veterinary Public Health Group at Boehringer Ingelheim Animal Health. She works with nonprofit groups, government agencies, and public health professionals to implement veterinary rabies prevention programs. And her primary focus is technological improvements of oral and injectable veterinary vaccines. She led the licensing of the first U.S. oral rabies vaccine for wildlife, as well as the first non-adjuvant injectable canary pox rabies vaccine for cats. So she has a lot of experience in immunology and the species that we're interested in, and I'm really happy to have Joanne here to take us through the next session.
Thank you, everybody. It's an honor to be here. I've been able to be involved with ACC&D one time as on the board, but now as a technical director, and they're one of the most passionate and, I think, thoughtful groups that I've ever worked with. So my presentation today, I can make my disclaimer. I did not do any of this work. I'm actually reporting the work of others, and I'm just wanting to give a summary of what we have learned about GonaCon in cats. Everyone's seen this slide more than once, so I won't spend too much time on it. The point that I want to bring out about the GnRH vaccine mechanism is that the binding of the GnRH is with the circulating antibody, and it is a site where the complexes of the antibody and the peptide remain out of the venous blood system, so the interaction there at the pituitary gland does not happen. So what is GonaCon? GonaCon is a vaccine that is produced by USDA National Wildlife Research Center in Fort Collins, Colorado. It has an EPA license, but the backbone of it is the GnRH peptide, which you see there. And it is bound to a carrier protein. In earlier versions, it was bound to the keyhole limpet hemocyanin molecule, but in latter versions, it was bound to another protein from a mollusk called blue protein. It's coupled at a ratio of around 30 molecules of the peptide to the carrier protein, and then it's placed with an adjuvant that has a really strong immune response in all the animals it's used in. It was an adjuvant that was originally used in a cattle vaccine for Johne's disease. It contains mineral oil, and it was called Mycopar. But NWRC modified the adjuvant and repackaged it and renamed it as their own adjuvant called Adjuvac. And the vaccine itself is a very thick emulsion. So it's an oil and water type of mixture that has the droplets of the active suspended in the oil. So, and NWRC has a mission to be working on pest species and controlling species that have concerns for the environment. And so they had worked on this product for several years with a focus of looking at it in white-tailed deer and in horses and wild burros. But I went to their website and found that they had also done studies on other animals with GonaCon, including squirrels, rats, feral swine, and that they were able to show efficacy in a variety of species with the GonaCon single shot. And so that really brought it to the forefront as a possible contraceptive vaccine for other species. So in those species that they investigated, they were able to see as long as 5 years immunocontraception, and that's a great target for both dogs and cats. And that was one of the reasons why I believe that we were very much interested in seeing what it would do with cats. So some of these studies have already been mentioned, and I'll give you some real quick summaries of them. Dr. Julie Levy has been instrumental in taking a look at this vaccine in both male and female cats. Lindsay, who you saw in the previous session, did a study in 2017 on spayed cat females as a safety study, and then Amy Fisher, who you've also seen speaking and who's actually speaking in the other track, has done the bulk of the work that I'll be talking about in a publication that was in 2018 on intact females exposed to males in a colony situation. So with Dr. Levy's first study in males, it was a relatively small study in laboratory cats, and the one single dose was given at different levels of GonaCon, but it didn't really seem to have an impact on what level was given. They either had responders or non-responders, so the data was presented in that parameter saying that out of those cats that were vaccinated, 6 of the male cats did have antibody titers of greater than 32,000. And in those responders, there were characteristics that would be expected with immunocontraception, such as testicular size decrease, testosterone levels were decreased, and histology was showing that there was involution in the testicles that indicated decreased sperm, but fertility was not evaluated, and there were low levels of sperm in the semen of those cats. So there was a definite impact, but it did not go beyond this kind of level of inquiry. Her second study was in female cats, also laboratory cats, taking a look at a single dose in the females and asking the question, again, what kind of antibody response did they have, but she also looked at contraception. So in this study, you can see the data presented basically the same data in 2 different ways, where over time they looked at the mean time to conception of both the vaccinates and the controls. And within her study, they introduced the males about 120 days after administration of the dose of vaccine, and the controls were all pregnant within 4.5 months. And then in the vaccinates, there were different varying levels of time between exposure to the males and pregnancy, but you can see that within that group, they had some short responders that became pregnant within 2 years, but the majority of those cats did not become pregnant for more than 2 years. And you can see at the bottom there the percent that remained infertile was very encouraging, and this kind of set the stage for additional work. So in her study, as I said, the infertility was excellent for more than 1 year in the majority of the vaccinates. She did find that antibodies were present and they varied between individuals, but there was a trend that cats that showed a decline in their antibody levels were the ones with the shortest fertility. Not a specific GnRH titer was predictive of whether or not the cat would become pregnant, but it was the persistence of those antibodies over time that was associated with infertility. This was reporting also of non-painful granulomas, which is not expected because that adjuvant that is used is a pretty inflammatory adjuvant, but those were persistent at the injection site. They didn't appear for about 2 years, but they really didn't cause much problems with the cats, and it wasn't in all of the cats, and they were noted in her study. So at the end of this study, it was shown that the GnRH pathway was really an ideal candidate, that more work should be done, and that, yes, multiple factors do influence the immunocontraceptive effect of this vaccine in cats, but it looked very positive. So I have some slides from Amy Fisher. She gave some summary statements to the Council of Stakeholders for ACC&D, and she shared some of the slides with me. Her summary was that Dr. Levy's studies showed that there was an impact on laboratory cats with suppression of sexual behaviors, and that between the 2 studies, the female was more likely the better candidate to be vaccinated with GonaCon. The formula that was used in Julie's study gave infertility for more than 3 years, and that the antibody titer was impactful. And even though, as I mentioned, there were some long-term injection sites, they weren't bad enough to not go forward. I do want to make mention, this is actually a table that Lindsay has in a summary article she has with Julie Levy, that there was some differences in the formulations over time with GonaCon. About the time that GonaCon was developed, the keyhole limpet hemocyanin was being used experimentally, and then was found to be a research material that was very much in demand for human studies, I think particularly in cancer and other developments. And so the price of that reagent went really, really high. And that was one of the drivers for them to come up with a different carrier protein, and they switched to another mollusc protein in the latter formulations. So between the Levy studies that I've already spoken about and the next two studies that I'll speak of, the route of vaccination remained the same. The volume of vaccination remained the same. We had a much higher active in the more recent studies of around 1,000 micrograms per ml of the GnRH protein concentration. The adjuvant's the same, and the actual part of the adjuvant that may be responsible for some of the inflammation, the Mycobacterium avium in that adjuvant, was the same. So you can see those are the differences between the types of vaccines used in these reports. So as Lindsay mentioned, there was a small study taking a look at the new formulation that we wanted to see whether or not the new formulation would cause problems in cats prior to doing a larger study. So there was a group, this is called the CREW study, and it was 6 spayed female cats that were not random source cats. They were laboratory cats. And the idea was to take a look at not only the site reactions, but the antibody responses. So within the groups, one of the other questions that was wanted to be asked was, if by mistake in the field a cat that had been vaccinated with GnRH once before actually had a second exposure to the vaccine, would there be a really serious response in either inflammation or what would we see with that kind of incident? And the study showed that you could have more than one dose, and the lesions did appear in those cats as post-vaccination lumps, but it wasn't anything dramatic. So one group did receive a saline injection first with the second vaccination at 60 days of GonaCon. The second group had GonaCon on day 0 and also day 60. And yes, there were granulomas in the cats. The mean appearance date was around 110 days. In that table, you can see that not every cat had a granuloma. The variation is pretty significant between cats, but the overall scenario was that yes, we could go forward and that the safety was fine with the new formulation. So the whole concept was, could we give GonaCon to a significant number of cats that are housed in a colony situation with the target of having at least 3 years of contraception, that it would be safe? And the prospect was, instead of doing laboratory cats, can we do this with cats that would be similar to that found in the field and would be similar conditions? So as Amy Fisher spoke about, this was conducted at an amazing facility that was constructed for this use called Clowder Concepts. She mentioned it is a USDA and state-inspected research facility, and the conditions there are amazing. I joked that I would have easily lived there during my college days. It looks great. So they have not only this social environment, they had the opportunity to interact with the students there. They had enrichment programs, and they had access to outdoor roaming areas during the course of the study. So I think this was an excellent way of taking a look at cats in real-world conditions. So before going into the data, I just want to make mention that this has already been published. It's under this article here with Amy Fisher as the primary author. And if you're interested in more details of the study, feel free to take a look at that. So what happened was there were multiple cats, but out of the group that were selected over time, 20 females ended up being vaccinated with 10 female controls. And so day 0 is the single IM dose of GonaCon. Then males were induced around 115 days, and they actually rotated in different male cats over time in case that there was concern that maybe a male cat would have not been fertile or had been able to breed with all the cats due to behavioral issues. Daily observations were made, the vaccination sites were palpated, there was a lot of hands-on evaluation of the cats during this entire study. Monthly pregnancy exams by ultrasound took place, and any cat that was found to be pregnant was spayed within a very short period of time, within 8 days after finding the pregnancy. And all the pregnant cats were spayed, and at the end of the study, actually all the cats were spayed and adopted out. So just as a graphic, again, this is one of Amy's slides that I like. Day 0 was the injection. Day 120 is the introduction of the males. Throughout the study, we had planned to go as long as 3 years, but due to the responses observed, that the study was terminated right around at 1 year. And I'll show a little bit of the results. So disappointingly, within the breeding trial, within 30 days, 6 controls became pregnant, but also 8 of the vaccinates. Within 4 months, all of the controls had become pregnant, but within the vaccinates, there was 60% pregnancy rates, and then 2 additional queens became pregnant within less than 1 year. So there was only 6 vaccinates that were remaining on the study. Based on these results, it was a hard decision, but the decision was made to go ahead and we need to stop the study because it's just not performing as we were hoping for. Within that group of vaccinates that remained infertile, there was no estrus behavior in 4 of those 6, and 2 of the queens that never became pregnant did display estrus, but they never did conceive. So that was kind of the summary of what happened. If you take the same kind of graphs that Julie had and take a look at what happened here, you can see that there is a very significant difference with a much compressed time frame. So the 1,000 micrograms of the vaccine active with the blue protein was one difference. The males' introductions were very similar to Julie's studies. It was terminated early, of course, but there were some significant variables within the study. It was found that the mean time to conception of the vaccinates was higher than the controls, 212 days versus 127. And as mentioned, the percentage of conception was unsuitable for us to go forward. And I already said about the infertility of the 6. As for the reaction sites, yes, there were reactions seen in the cats. Within the vaccinated group, there were 9 cats that showed some type of delayed site reactions. The way this is scored is based on size. If there was inflammation without a mass, there's a single positive sign. If cats were adopted out towards the end of the study, we were not able to get the data there, so you can see that. So yes, they kind of waxed and waned. They showed up at different times. The feeling was that, yes, there were inflammation results due to this vaccine, but it did not have that dramatic of an impact, very similar to the other studies. So the injection sites were ranging in size from just soreness and swelling following vaccination to actual masses. 2 cats that had these masses did not become pregnant, but the others did. So that didn't really have a correlation. I mentioned that the vaccinates had a longer time to conception than the controls. And one last point was that the litter size of the vaccinates was smaller, but, and it was significant, but not dramatically so. And as I mentioned, all cats were sterilized and adopted out. So in conclusion, this single dose of the batch of the GonaCon vaccine that we received from NWRC was not delivering the same type of response that had happened previously with Dr. Levy's. The cats were housed differently and under colony conditions, and this was disappointing to everybody involved in the trial. So why did that happen? We're still having the discussions around this. There's 3 potential areas that we felt could have an impact. One would be, of course, we did mention the fact that the vaccines did differ some, but could there be some quality control issues or other type of problems with the vaccine being made? We did a thorough discussion with NWRC, and I can say they were very transparent and told us from the beginning of the batch to the end of the batch how they managed their process. because it is an EPA licensed vaccine and not a USDA or FDA licensed product, there are some differences in control testing that is required to produce this product. But that was one thing we wanted to focus in on. Also, the cats were random sourced. They were different than Dr. Levy's sources of cats, and then the environmental conditions were different. So just to touch on those points, and they are open for discussion, the formulation was the same as the crew cats, which had a good immune response, but it still was a different batch. We could not figure out from the production records, was there something that went wrong, or was there some kind of problem in shipping the vaccine from Colorado to the site of the study. And because we had waited for the serology and the pregnancy results, being able to compare the previous doses of vaccine in the lab with the one that we used was not possible because they both had expired. So that's some learnings that we took away from this is, even though we wanted to look at the two vaccines in the lab, by the time we asked that question, it was a bit too late. So within the cats themselves, there can be different variations of the GRNH antibodies. We saw that in Julie's studies as well. There was different variables of time on inset and duration. My impression is that GonaCon is going to yield a very heterogeneous response in cats, be that laboratory or random source. And the variability that was seen between the studies is quite dramatic. So there should possibly be some other factors that we are more than just the individual cats. And then last but not least, the environmental conditions. The introduction and rotation of the cats in a social type of environment instead of laboratory, I think is something that is interesting and should deserve some additional conversations. There are some comments in the literature about GonaCon that within white-tailed deer studies, the caged or penned deer had a better contraceptive effect than when they took it into the field. And their concept was that captive deer don't have the same kind of environmental stressors on them that field animals do, and that under a situation where they're well fed and under veterinary care could potentially have an impact on the supposed stress level. These cats that we had at this facility were under excellent veterinary care, excellent feeding conditions. A lot of controls were in place. So that's an interesting point, but how it applies in this exact scenario, we can discuss that as well. And the environmental conditions that were chosen to test this vaccine, I think, were an excellent way to anticipate field use of the product, and it just didn't hold up to those conditions. So takeaway thoughts, the GnRH pathway still remains a very viable target. It's just that this tool doesn't seem to be as consistent as we were hoping, and it doesn't seem to be giving us an indication that it could be modified to give us that 3 years. Why it worked well with Julie's and not as well as this is its data, and do we do more? The multiple factors of cats and how they live in the real world will continue to play an important part in this, and this persistence of serum antibodies over time is some things that we just don't know how to impact at this point with this adjuvant and with this vaccine. So in closing, really, this cat colony model opens the door to create an excellent environment to evaluate other targets, and I think the learnings from Amy's discussion yesterday, and I believe in the field tract as well, is to say that this kind of test is a rigorous test for these kind of products, and I would support continuing this kind of evaluation model. So as Amy's slides again, just to real quickly let you know, again, I did not participate in this work, but there was a huge human team of very dedicated individuals that spent an awful lot of time making sure that the cats were well cared for, and all the data that could be gathered were gathered under some excellent review by many people on the ACC&D team. Plus others. And then she mentioned too that there was a long list of cats that came into the study and were adopted out. And then lastly but not least, the funding of this was with Morris Animal Foundation and the John and Jane Widerhole Foundation. Lowell Miller, who had been involved with the development of GonaCon, came out of retirement to provide opinion and assistance and discussion on why these results were different, so we appreciate his input. Also the people that were involved with the University of Illinois that volunteered and were involved, and of course the people that adopted the cats. So those are just some of the references that I mentioned, and with that I say thank you.